Hello and welcome to Askimo TV. I'm talking today to Dr. Julian Rowe-Jones. Dr. Rowe-Jones is a consultant nasal surgery specialist at the Royal Surrey County Hospital in the UK and the director of the Nose Clinic. Hi, Dr. Rowe-Jones. How are you?
Good morning. Hi, Joanne.
Dr. Rowe-Jones, let's talk today in more detail about balloon sinuplasty. What is sinusitis?
Sinusitis is inflammation of the lining of the sinuses. The sinuses are like bony boxes or caves in the skeleton of the face, and they produce mucus from the lining, which has to drain into the nose through tiny little channels. If those channels get blocked, then the air can't get in, the mucus can't get out, and that's a good environment for infection to develop. So that is, sinusitis can be infection, but it can also be just inflammation even without infection. Someone who has a cold or someone who has bad hay fever will have inflammation of the sinus lining even if they don't have an infection.
For what reasons would balloon sinuplasty be recommended?
Most of the time, patients who have problems with sinusitis have a long-term problem because their linings are oversensitive. That's how they're made, if you like. It's rare that the problem is just a one-off infection after a cold, certainly for the patients I see. So what we're looking to do is make the drainage holes and the drainage pathways as wide as we can so that the mucus can get out normally and that the air can get in and circulate to keep the lining healthy. So what we're looking to do with any procedure is make those little holes and gutters and drainage pathways as wide and open as we possibly can.
What are the advantages to balloon sinuplasty over traditional sinus surgery?
Traditional sinus surgery, endoscopic sinus surgery, is usually looking to remove membranes or small, thin pieces of bone to make holes and drainage pathways bigger. The advantage of balloon sinuplasty is that we can stretch holes to make them wider and gently move bone with the balloon without actually having to remove anything. And this, one, is less aggressive, but two, is less likely to cause scarring, and scarring can have an adverse effect on the results of our surgery. So it's gentler on the tissues.
Is the procedure safe, and are there any risks to the procedure?
The procedure's been performed over 100,000 times worldwide now, and currently there are no reported serious adverse events. Having said that, we always have to be very careful because the sinuses are positioned very close to the eye and the brain. So even with expert hands and even with the most gentle techniques and gentle tissue handling, it is possible that there could be an injury to the eye that's close by or the brain. So we can never say anything is completely risk-free.
How will a patient feel after the procedure, and how long will the symptom relief last for after surgery?
I think one of the great advantages of balloon sinuplasty is that the downtime is significantly less. If we're not removing tissue, there's less chance of bleeding postoperatively, and there's less pain, so the healing process is quicker. So on the whole, I would hope that patients would go back to work the day after the procedure. If they have it done under local anesthetic, they might even be able to go back to work that afternoon. So that's a significant advantage. But we have to remember that we're not just treating one condition. Sinusitis and polyps have an array of severities. So probably balloon sinuplasty is for the less severe cases. So we have to be careful that we're not comparing a technique for less severe cases with a different technique for more severe cases.
Can balloon sinuplasty be used for children?
I'm sorry, Joanne, just say again, I just lost you.
Can this procedure be used for children?
I've never performed it for children, and I think that's because, in fact, we're looking to avoid surgery in children because the sinuses in children are very small. So children who have symptoms that might suggest sinusitis generally have inflammation in the nose, the sinuses throughout. So one of the first op treatments with children actually is still adenoidectomy for sinusitis. So good medical treatment in the nose and adenoidectomy. So it would be extraordinarily rare, other than for a very unusual sinusitis, perhaps a very severe sinusitis in the frontal areas, that such surgery would be appropriate in children. It would be very unusual.
Thank you, Dr. Rowe-Jones. Thank you for talking to me today.
My pleasure.